Okay, good morning, everyone. Can we, everybody take their seats? Those of you who are gathering breakfast in the other room, if you can hear me, please come on in. We're going to get started. Our morning sessions ran a touch late, so we're going to get underway here. So if everybody can take their seats. Over in the back. Thank you. And if we can just everybody quiet down because we're going to get started. So welcome back for the last day of the GBCHealth conference. I hope everyone enjoyed last night's reception. I thought it was fantastic that everybody stuck it through quite a few speeches last night. We had a tremendous level of attention. In fact, from all the conferences that I've participated in, I think the level of engagement, the number of people who are remaining through all the sessions, really this marks a high mark from what I've seen. And in fact, since this is the last day of conference, I have to tell you that after today it does end. If tomorrow, Saturday, you find yourself wandering outside the Roosevelt Hotel looking for teal green signs with an arrow pointing you towards a conference, that's something called GBCHealth Conference Withdrawal. It's treatable. If you're doing Google searches trying to find President Franklin Roosevelt's speeches on HIV and AIDS, they don't exist. That's also a sign of withdrawal. And if you're at home sitting in your largest room waiting for a panel to walk in and speak with you, that's GBCHealth Conference Withdrawal. So we hope everyone's enjoyed the several days that we've had together. We have another great day today. Some of you, I'm looking around the room, look particularly relaxed. I think you must have been the people who went to the meditation session. Everybody's looking excellent. So our program today, the final full day of the conference, is one that's going to inspire you with ideas to take back to your companies and organizations. We have a few surprises. I also want to officially acknowledge, you may have seen this magazine on the tables in the room. In fact, I think there's some there right now, Global Health and Diplomacy. This is issued by the Center for Global Health and Diplomacy. They arranged this issue to track the conference. You'll find an article by Ray Chambers here, an article by Michelle Sidibe, and also they're the ones who have been live streaming the conference, I'm now told, to 4,500 people who've been following this. So I want to just throw a nice thank you out to Joanne Manrique, who runs the Center for Global Health and Diplomacy. Thank you, Joanne. So after yesterday's focus on MDGs 5 and 6, we're going to turn a good portion of this morning to child health, MDG 4. Dr. Richard Besser, Chief Health and Medical Editor for ABC News, will lead us through an important conversation on the leading causes of death of children under 5. We'll also look at workplace wellness, a core topic for GBCHealth members, with this year's theme focusing on women workers. Later in the day, we'll explore topics as diverse as NCDs, non-communicable diseases, social business models for health and digital health, and international corporate volunteer programs. So be sure to carefully review the program to get all the details on the sessions that will be running today. I'm also excited that later today, we'll be holding our first ever public service announcement contest with all the deciding votes on the winners accomplished by voting with our phones in this room. So we'll have more information on that over the lunch session. For our first general session this morning, we're going to take a closer look at the innovative financing for health, and specifically the Pledge Guarantee for Health Guarantee Fund that was introduced last night by USAID Administrator Rod Shah. Our distinguished panel this morning will provide more details about this pledge and shed insight on the potential of the private sector to engage. So to get us started, I'm now going to turn it over to Dr. Anders Nordstrom, Ambassador for Global Health from the Swedish Ministry of Foreign Service. Anders.
Thank you and good morning. This is the second day and last day of this very exciting meeting. I think there's been a lot of energy in the room, bright ideas, a lot of connections, and a lot of learning. What we're going to continue with today is to talk about what Gary said, the Pledge Guarantee for Health, but also talking about innovative financing to see whether we can find new and innovative ways of actually achieving more for the money and the resources that we have available. You heard yesterday the announcement by Rasha, myself, and Mike Dybel in terms of this new modality, this new facility called the Pledge Guarantee for Health, and we're going to also talk a little bit more what that is in practice. I'm joined this morning by a exciting panel. We've got Wendy Taylor from USAID. We've got Adam Shater from Merck. We've got the CEO and owner of Westergaard Fransten, Mikkel Westergaard Fransten. And we've got Seth Feisen from the Global Fund. I'm coming and representing the Swedish government, so being a public partner in this. And very, as I said already yesterday, exciting about finding new ways of actually engaging in a partnerships in between the private and the public sector. This is now the fourth guarantee that we are engaging in with different partners, in addition to doing our grant making. That's our main sort of way of working. The first guarantee was together with the Gates Foundation to raise more capital from the private market to be able to invest in late stages products that didn't really get the necessary risk capital to be able to take it off. Then we've done two guarantees, one with Merck and then one with Bayer, on making new contraceptives, implants, long-lasting implants available then at a very reduced price. That was announced now some months back. And now we're very excited about this fourth opportunity, also to see how can we actually solve and address the problem that sometimes there is a big lag in between when money, resources are needed in order to be able to meet the needs of people and when money is actually then coming. I've been working in, we have the Her Excellency, the First Lady here from Zambia. I worked in Zambia in 95 to 98, and I saw that things were ready to go, but still, administratively, it took a bit of time before the money actually flowed. And this is what this pledging guarantees then will try to solve. It's basically to, when we know that the money actually will come, but we have a number of administrative and legal sort of requirements that could take up to 14 months. Can we then speed up so that we ensure that we save lives at a higher speed than possibly that we're doing today? So this pledge guarantee for health facility basically is it's a partial guarantee, $50 million, raising another $50 million then from the private capital market, making that $100 million, available then for credits. Then over time, the estimation is that this will be able to generate then a capital flow of $1 billion. So the effects here are quite huge. And basically, as I said yesterday as well, what we're using is then our balance sheet from the Swedish government together with the balance sheet then from the US government to guarantee and take some of the risks here. And what we're going to do now this morning is to talk a little bit, is this helpful? What does it mean? We have two very important companies here that are engaging a lot in terms of global health and local health. I'm going to speak to the Global Fund about what this potentially could mean for the Global Fund. But first, I would like to turn to Wendy. What does this de facto, and why is the US engaging in this? And Wendy.
All right, well, thanks, Anders, and good morning, everyone. So I first just want to point out the context here. The need for acceleration is critical, and especially now. And when we're talking about child health, we've made tremendous progress in bringing down deaths for children under the age of 5 over the last 50 years has dropped 70%, but we still have so much more to do, and we've got 7 million kids that are going to die before their first birthday, and we certainly can be doing more. And so to meet our commitments to the Millennium Development Goals, to be able to bring an end to child and maternal death in a generation, which is what we're striving to do, we need to be able to work better and faster and smarter. And one of the ways that we can do that is really thinking about how we can use creative financing to be able to get better value for our dollars. And that's one of the things that's so exciting about Pledge Guarantee for Health. And I think it's particularly important when we're in this resource-constrained environment that we're in. So, and when we think about using these creative tools, it doesn't necessarily have to be that new and that creative. In this case, we're actually using kind of standard industry practice. We have a cash flow problem where we have slow or unpredictable funding coming in from donors, and we need to be able to bridge that gap. So this is just bringing in working capital to bridge that gap. I think that's something and people in this room can understand quite well. So figuring out how to come up with creative solutions like this or bring in best practices from industry is really quite important. And that's really infused with everything that we're doing in USAID, and it's certainly what we are working on in the center where I work. So we're deeply committed to this. We're very excited to be working with all of the partners here on this stage to relaunch Pledge Guarantee for Health and to back it with a guarantee, a 5-year guarantee that will help them leverage that additional working capital. And through this, countries will be able to procure life-saving commodities. They're going to get these bed nets, they'll get these medicines to people faster, they will save lives more quickly. And in doing that and having these predictable procurements, then suppliers should be able to gain some of the efficiencies as well. And so what we hope to see is the cost on some of these products coming down. And in fact, I think you're going to see some evidence of that in just a few minutes, and hopefully many of you in the room, as you get a better sense of this, you too will be able to see some of the benefits of this, and so we'll see more of this in the future. But anyway, it's an extraordinary set of partners. We're very excited to be a part of it and to spearhead this next effort. And I just also want to say I'm encouraged to see so many of you here in this room. I assume that you're here because you're committed to solving these major global health challenges, and there's a lot that we can be doing together where we can be seeking bold new ideas, forging new partnerships, and tackling many of these ambitious but achievable targets together. So thank you.
Thank you, Wendy. And so, I mean, this is for you a smarter way of also working and engaging. And did I also hear an invitation to people here in the room that if there is somebody that can also find out or come up with other, even more smarter ideas in terms of how we can use the resources that we have in a more effective way, I mean, the door is open.
Absolutely, through Pledge Guarantee for Health and also through other means. So the door is absolutely open.
And the door is open in Stockholm as well. So. Adam, you're representing Merck, one of the largest pharmaceutical companies in the world. Why is this of interest to you?
Thank you, Anders. Good morning, everyone. I can't think of any other place I'd rather be this morning than here to share the information about the partnership with PGH. We have learned over the years at Merck that in order to achieve our mission, which is to really develop innovative products that can help save lives, vaccines and medicines, that it only is successful if we can ensure broad access. And in order to ensure broad access, we've learned over the years that it takes public-private partnerships. And we learned 26 years ago with our Mectizan program, where a small white pill given once a year could eradicate river blindness in certain parts of the world, that it takes a long-term commitment. We've been doing that for 26 years. It's the longest donation program of its kind. We also have learned from things like our Merck for Mothers program, where a year and a half ago we committed a very significant investment to try to reduce mortalities of mothers. No woman should die while giving childbirth or during pregnancy. Last week we announced a partnership to ensure with partners that we have Gardasil, our cervical cancer vaccine, available at 2.4 million doses to Gavi-eligible countries. So the message is that we understand that important partnerships makes a difference in access to our products. And we believe that working with PGH on a 5-year commitment in order to ensure that our life-saving medicines and vaccines can be accessed sooner in countries where there's need could make a very significant difference. And that's important for our mission, and we're very excited to be part of it.
Thank you. Turning to the next important partner here, I mean, you've been extremely instrumental and important in terms of then the fight against malaria and the access to bed nets. What does this way of adding a new instrument mean for you as a company, Mikkel?
Well, it means a lot, but Anders, first let me start by thanking you and all the partners that are here and have been instrumental in putting the Pledge Guarantee for Health together. They're all partners that I've been working with for a long time and are proud to be associated with. My company is involved in public health, in climate change, safe drinking water and food security, but as Anna said, we're probably best known for the invention of the long-lasting insecticidal net and being the first to take that to global scale. And at this point, we've assisted our partners in the Global Fund, US government, and elsewhere, getting more than $500 million nets to sub-Saharan Africa. And we believe that that has played a pivotal role in reducing malaria deaths from more than 1 million people dying just 4 years ago to less than 680,000 last year. So the Pledge Guarantee for Health, to answer your question, is something that means that is valuable to us in a number of fronts. I think first it offers faster delivery because it's a bridge funding mechanism that can ensure that, as the case we talked about last night, you get the nets to Zambia before the rainy season rather than after. But it also offers reduced cost because it allows for longer term planning. And with the longer term planning comes the ability to also plan investments on a longer term. And I think that will help tremendously in stifling innovation, which is something that we're also seeing, unfortunately, in aid delivery. And I think it can challenge what we see as sometimes inefficiencies. And Mark Dybel, which I appreciate a lot, he mentioned last night very candidly that the goal should be to not need the Pledge Guarantee for Health in years to come. In your introduction, you also mentioned the need for other innovations. And I was actually reminded last night when we launched this program, when you spoke, an innovation that we've been working on for a couple of years now. In Kenya 2 years ago, we hired 8,000 people to go door to door to 900,000 houses and install a water filter in every house. And that benefited 4.5 million people. And we were able to, as we educated people in the communities about filtering water instead of boiling water, we're able to measure also how much water was filtered, how much less water was boiled, and how much less firewood was burned. And when that was audited by an independent third party, we could sell that as carbon offset and finance the free distribution of water filters. Now, the part of this that is interesting for this debate is the pay for performance part, because we had 4,000 smartphones and still have 4,000 smartphones in circulation in Western Province of Kenya, and get 35,000 uploads per day from households. And this allows for a very rigorous monitoring system. So when you gave the example of Coca-Cola and drugs yesterday, and we've all had this discussion in public health gatherings that, how come Coca-Cola can get out to this kiosk and that person and put a Coke bottle on top of Kilimanjaro and we can't do this and that? The answer is simple. Coke doesn't get paid until they reach the end user. And so similarly, in Western Province, where we sell carbon offset through water filter, we're not paid a single cent until we, in highly regulated monitoring, has proved how much water was filtered and how much less firewood was burned. And so if you take that into bed nets with such a monitoring, you can actually, when combining public health and the data rigor from public health with the methodologies from climate change, you can actually come to a space where the donor doesn't need to upfront money and hope for the best, but can actually pay for an impact that's already documented. And I think that's a very interesting space to be, especially as we talk about how do we create more efficient spending. So.
Thank you. Just coming back both to Adam and to yourself then, with one follow-up question before going to Seth from the Global Fund. In terms of, because this is what I'm most interested in, that is to get the products out at the best possible prices to as many people as possible. Will this kind of guarantee have an effect on the prices of the products? Either by then having a more rapid turnaround then of the resources, and you will have secured resources, but you still might trust that those that are providing the money still will pay, I don't know. But we are taking some of the risks, if they might not, actually, the US and the Swedish government. But also, as I was mentioning, the volume guarantee. Will this kind of instruments that are complementary for some of what the US and the Swedish government is doing in actually providing cash in terms of grants, will that have an effect on the prices of your products?
So we continue to look to make sure that we price our products, and we actually use a differentiated pricing system, so we try to price based upon market needs. And in addition to that, with this program, we're actually pledging to give an additional discount for countries that use the PGH program. The intent is to actually offset the financing to a large degree and help to reduce the cost of the financing. So we believe that part of the barrier is the timing from the time that the money's available to, or the money's actually granted to the time you actually receive the money. If we can shorten that time through this creative financing program, we believe it's a faster way to save lives. It's all a more predictable way to ensure payment, and that we can work to give even better costs, particularly to cover the financing.
Yeah, I think, we've made a similar pledge to work in cost reductions, but I do strongly believe that this is a smaller part of this. I think the much bigger part of this is to allow for forward planning, forward investment, and really drive efficiencies. That doesn't mean necessarily just cost reduction, but a dramatic reduction in the cost of use rather than just the cost of product.
Thank you. Adam, you were mentioning the announcement in Joburg a couple of weeks or a week ago now about the HPV vaccine and the reduction of costs there. And turning then to threats from the Global Fund, I'm both at the Global Fund board but also at the Gavi board, and my experience is that Gavi has worked quite in a structured and systematic way with the private sector, with the vaccine industry, to be able both to make the necessary investment in the research and development, but also negotiating here and using then different instruments like guaranteeing a certain volume for the rotavirus vaccine, making that available now to countries at quite a reasonable price. And they're continuing that work in a very systematic way. And the last now announcement of the HPV, I think hopefully that's just the beginning of ensuring that we can roll out HPV across the world, as we heard a call for that for yesterday as well. But the Global Fund, I've been following the Global Fund from the very beginning. I haven't seen the Global Fund really, and you are the biggest buyer today. So what's in your pipeline now? Will you engage more?
Look what's coming.
Okay.
I don't know if many of you picked up when Michael was talking. He just sort of passed right through the fact that they've been involved in distributing 500 million mosquito nets in sub-Saharan Africa. 500 million nets. Can you get your head around that? It's a tremendous job. And in our malaria programs, that's a big part of what we do. Our ability to deliver on a tremendous scale this very simple technology of a net that protects people and that now is treated with insecticide, so it's actually killing the mosquitoes that land on the net, which of course reduces the spread of the disease as well. So as we look at greater volume, we, in the words of Ray Chambers, global fund, global fund, global fund. We're very focused this year. Many of you may know we work on a 3-year cycle for raising money so that we can provide predictable grants. And this is a fundraising year for us, and we've targeted $15 billion from our donors. But we have to be creative in how we do things, and innovative financing, what we're here to talk about, can play a big role in acceleration rather than sitting and waiting for donated funds to come. We need to be aggressive and creative in how we do financing. And anybody who's worked in business knows about the need for financing and how flexibility and timing can really help you accelerate to your goals. Some of you have heard about the reforms that have been going on at the Global Fund in the last couple of years, and one of the pieces of that is bringing some private sector values into the way we do operations. What does that mean? That means we have a new CFO who comes from the private sector. We have a new head of procurement who comes from the private sector. I come from the private sector. As Anders says, he's been watching what Gavi has been doing, and the Global Fund is now following that track. And it will affect pricing. It'll not just in delivery, but also in the cost of products as we move forward with smart procurement approach. But innovative financing is an important piece of that, and it'll help us get there faster, as I'm sure many of you can appreciate.
Thank you. We have a huge task in front of us to support you to raise those 15 billion. But I think we should also remember that those 15 billion is just a share out of the 85 billion that are actually needed for the fight for the 3 diseases. And the majority of the resources that need to come, that are already coming, are coming from countries themselves. from taxpayers in Zambia, from Kenya, from South Africa, and the resources are increasing actually from those countries today. But still, the 15 billion are definitely needed and will make a huge difference, hopefully. But what we've been speaking about here, and I'm going to conclude with that, is to see, can we also find ways of making more efficient use of the resources and finding ways of actually not just delivering what we have been delivering for then sort of 15 billion, but can we deliver more by a more structured engagement then in between the global fund, public governments, partners, board members like ourselves, and the private sector and the industry. And I strongly believe that, and I think the experience we have from Gavi shows that that's definitely possible. I was in Senegal, in Dakar, and I had a full-day meeting now just a week ago with the minister there, and we spoke about how can we as international partners engage more effectively with you here. And we spoke about a number of things, including then procurement. How national governments do need to find ways of actually more effectively speed up access to resources, administrative procedures, but then also to be able to benefit from globally negotiated deals. So if there are negotiated globally sort of prices here, highly appreciated, but we haven't really put this into practice 100% yet. So I think there's a huge potential here for partnerships in between government, people in ministers of health in countries, and then also strong support then, like from this kind of meeting where we have an interaction between the private and public sector, and taking that engagement and that commitment down to reality to save people's lives. And that was to finish on that, impressive to learn from Senegal in terms of the reduction of malaria deaths. And that has been because of then the distribution and more availability of bed nets. So big success, and I think we give the panel an applaud. Thank you very much.